Seasonal influenza, commonly known as a flu, is an acute respiratory infection caused by influenza virus. There are four types of influenza viruses, types A, B, C, and D. Influenza A and B viruses circulate and cause seasonal epidemics of the disease. Influenza A viruses are further classified into subtypes according to the combination of the proteins on the surface of the virus. Currently circulating in humans are subtype A, H1N1, and H3N2 influenza viruses. Only influenza type A viruses are known to have caused pandemics. Influenza B viruses are not classified into subtypes but can be broken down into lineages. Influenza type B virus that belong to either Yamagata or Victoria lineage. Influenza C virus is detected less frequently and usually causes mild infections, thus does not present public health importance. Influenza D viruses primarily affect cattle and are not known to infect or cause illness in people. Influenza A is the only type that causes pandemics. But influenza A and B are the two main types that routinely spread in humans and cause seasonal epidemics, flu epidemics. When we came to transmission, seasonal influenza spreads easily with rapid transmission in crowded areas including schools and nursing homes. When an infected person coughs or sneezes, droplet containing viruses are dispersed into the air and can infect person in close proximity. The virus can also be spread by hands contaminated with influenza virus. To prevent transmission, people should cover their mouths and the nose with a tissue when coughing and wash their hands regularly. In temperate climates, seasonal epidemics occur mainly during winter, but in tropical regions, influenza may occur throughout the year, causing outbreaks more regularly. Signs and symptoms of influenza usually begin around 2 days after being infected by someone who has the virus, so the incubation period is averagely 2 days. Symptoms include sudden onset of fever, usually dry cough, headache, muscle and joint pain, severe malaise, feeling unwell, sore throat, and runny nose. The cough can be severe and can last 2 weeks or more. Most people recover from fever and other symptoms within a week without requiring medical attention. However, influenza can cause severe illness or death, especially in people at high risk. Influenza can also worsen symptoms of other chronic disease. All age groups can be affected, but there are groups that are more risk than others. Those includes, especially those people that are at great risk of severe disease or complication include pregnant women, children under 5 years of age and older people, individuals with chronic medical conditions such as chronic cardiac, pulmonary, renal, metabolic, liver, hematologic, or neurodevelopmental diseases, and also individuals with immunosuppressive conditions or treatment such as HIV, receiving chemotherapy or steroid. Healthcare workers are at risk of having frequent infection due to frequent exposure to a patient who is having the influenza virus. Diagnosis of influenza is most commonly clinical. Most cases of human influenza are clinically diagnosed, but laboratory confirmation is commonly performed using direct antigen detection or virus isolation or detection of influenza-specific RNA by reverse transcriptase polymerase chain reaction. Rapid diagnostic tests are used in clinical settings, but they have lower sensitivity compared to RNA detection. Most people will recover from influenza on their own. People with mild symptoms should stay home to avoid infecting other people, rest, drink plenty of fluids, treat symptoms such as fever, and they should have to seek medical care if symptoms get worse. People at high risk or with severe symptoms should be treated with antiviral medications as soon as possible. This includes people who are pregnant, under 5 years of age, above 65 years, living with other chronic illness, receiving chemotherapy, or living with immunocompromised state. There are drugs that are FDA approved, such as peramivir, zanamivir, and oseltamivir. You can use one of them. Regarding prevention, vaccination is the best way to prevent influenza. Safe and effective vaccines have been used for more than 16 years. Immunity from vaccination goes away over time, so annual vaccination is recommended to protect against influenza. The vaccine will make the illness less severe and reduce the chance of complication and death. And vaccination is especially important for people at high risk of influenza complication and their carriers. Annual vaccination is recommended for pregnant women, children between 6 months to 5 years, people above 65, people with chronic medical condition, and healthy workers. Other ways to prevent influenza include wash and dry your hands regularly, cover your mouth and nose when coughing or sneezing, dispose of tissue correctly, stay home when feeling unwell, avoid close contact with sick people, and avoid touching your eyes, nose, or mouth. Thank you for watching.